So these are traumatic injuries of the teeth, basically fractures and how to treat them. So these are all classified under AVDC nomenclature, but I'm going to go through them anyway. So these are all the fracture types. So you have enamel infarction. So this is basically where the enamel cracks and you won't lose any tooth substance. So you can see the cracks, but the enamel is kind of there, dentin's there, and you know it's there because it's white. You have the next type, which is, enamel fracture. So this is the first fracture we see. So this is a crown fracture. You can see because the top layer is affected. So this is the crown. Sorry, so just to be clear, the crown is any of the tooth exposed, and the enamel has fractured, as the name suggests. So yeah, it's a crown fracture with only loss of the enamel. So just to be clear, crown is the bit of the tooth exposed, the enamel is the top layer of the crown. Okay, next we have the uncomplicated crown fracture. So this is sort of what we mentioned. There is a crown fracture, so there's loss of the crown, but it's affecting nearly all the layers now. So you have the dentin gone, the dentin gone, which is here, the enamel gone, which is here, but the pulp has not been touched yet. Now, with a complicated crown fracture, the pulp has been exposed. So yeah, what's the difference between uncomplicated and complicated? Uncomplicated, the pulp hasn't been exposed. Complicated is when the pulp's been exposed. We know why, because you get other issues like pulpitis, abscesses. It's not good, is it? So when we come to the uncomplicated crown root fracture, so this is where there's not just a fracture of the crown exposed above the gum, but also the root under the gum, which leads to inflammation. But because it's uncomplicated, the pulp hasn't been exposed. Now, when it's a complicated crown root fracture, as the name suggests, it's complicated because the pulp is exposed. It's crown root, so the bit of the crown has been cut off, the bit under the root's been cut off, and there's a fracture. It's not just like a crack like the first type. So how do we treat this? Well, if there's a small chip, I don't know if there are any pictures. Okay, we'll try and use this. Okay, so if there's a small chip, just ignore the inflammation of the pulp. But yeah, what we'll do is just focus on home management. So, you know, if it's something not as severe, let's say let's say it's this, you know, even here, it's almost barely noticeable, like I can't really see it. So we'll tell the owner to manage it at home with activities that basically prevent further trauma, you know, underneath that. Now, if the dentin is exposed, you might use a dentin sealant, and you can even extract the tooth, but extracting isn't ideal for useful teeth, like let's say the canines, which are kind of, they rip the meat, and the molars, they kind of chew the meat. It also says here the best therapy generally is a root canal therapy or a pulpectomy. Of course, this would apply in this case, a more complicated fracture. So basically, yes, the pulp is removed through the fracture site. So you remove this. Or you use a drill to get there. You disinfect the area, let's say with hot sterile saline, you dry it and you obturate it with a disinfectant root canal sealer, like it says Emgenol cement. I think that's how you write it. I can't say it. And you can also do vital pulp therapy. So what is this? You remove 5 millimeters of the pulp, use some drugs, and you hermetically seal to prevent leakage of the pulp, because remember, it has the blood vessels inside. But you only do this when, let's say the gold standard, the root canal or the pulpectomy isn't going to work. You do this for dogs that are less than 18 months old because they have immature teeth, so they're not able to have the root canal therapy.